Have you ever wondered if the way you take care of yourself today is really what your body needs, especially once you've passed 60? You're definitely not the only one. It's one of the most frequent concerns I hear from men in this stage of life. It's not just the question of, is it still okay, but how to approach it in a way that's safe, supportive, and actually benefits your health rather than draining it. I'm Dr. Elizabeth Rains, and over the years, I've guided thousands of men who want to stay in tune with their bodies, hold on to confidence in their sexuality, and move through aging with strength and dignity. And in today's video, we're going to open up a conversation that almost never happens, but absolutely should. How to keep self-pleasure safe after 60, and the 3 critical mistakes you must avoid. This isn't about embarrassment. It's not about chasing performance. It's about protecting your circulation, your prostate, your hormones, and your sense of well-being. So if you've ever felt uncertain about what's normal or what's wise, you're exactly where you need to be. Before we dive in, I need your help for just 10 seconds. Please write in the comments where you're watching from and how old you are. This is really important. It helps me create future content that's going to be the most useful for you specifically. Let me start by reassuring you of something important. Masturbation isn't only normal, it's genuinely healthy, especially as we get older. You see, as the years pass, many men begin to question whether their body still needs this kind of release. Or worse, they start to feel ashamed for still wanting it. But here's the truth. Regular, gentle self-stimulation is one of the simplest and most natural ways to support your male health after 60. It helps keep blood flowing through your penis. It nourishes your prostate, it lowers stress hormones, and it even helps improve sleep quality by calming your nervous system. But, and this is a critical point, the way your body responds to touch in your 60s or 70s is very different from how it did in your 20s or 30s. And there's no shame in that. It's not a failure. It's biology. As we age, our skin becomes thinner. The nerve endings that once fired instantly now take a little more time to respond, and the blood vessels, especially in sensitive areas, can be more delicate and easily strained. That's why your approach to self-pleasure needs to change along with your body. This isn't about using more force or chasing intensity like you once might have. It's about tuning in, being mindful, being present, listening to your body with care instead of treating it like a machine you need to fix. When you slow down and connect with yourself in a more thoughtful way, the experience becomes not only more pleasurable, but far more beneficial to your long-term health. Many men never hear this. No one teaches them that the old patterns might not work for their body anymore. So they keep doing what they've always done, and they end up feeling frustrated, disconnected, or even a little hurt, both physically and emotionally. But the moment you realize your body just wants something different now, something slower, kinder, more gentle, that's when things begin to shift. That's when a new kind of pleasure becomes available, a kind that feels deeply connected and healing. The first mistake, and this is a common one, often developed over time without even realizing it, is using too much pressure. I can't stress this enough. Many men, especially after 50 or 60, begin to grip more tightly or move more forcefully during self-stimulation. Sometimes it's out of habit. Sometimes it's because the body feels a little less sensitive, and they're just trying to feel something. But while the intention makes sense, the result can cause more harm than good in the long run. Here's the thing. Your penis isn't just skin and muscle. It's made up of delicate sponge-like blood vessels, sensitive nerve endings, and soft tissue that's designed to respond best to steady, gentle touch. When you use a tight grip repeatedly, it creates friction, squeezing, and strain on those tissues. Over time, this can lead to decreased sensitivity, where your nerves stop responding the way they used to. Some men even develop what's been informally called death grip syndrome, where their body becomes trained to only respond to one very specific type of pressure and motion, usually their own hand. This makes it much harder to enjoy intimacy with a partner or to experience natural arousal. It can also lead to soreness, irritation, or tiny tears in the skin that you may not even notice at first. And if that area becomes inflamed or damaged, it can make future touch less comfortable, less enjoyable, and more stressful. That creates a cycle, and it's one you can absolutely break. The solution is all about gentleness. Try loosening your grip just a little. If it feels strange at first, that's okay. It might take a few days or weeks for your body to adjust, but it will. You can also use a natural, unscented lubricant to reduce friction and protect your skin. Focus more on how the experience feels rather than trying to get it done. Breathe deeply, relax your body, and think of this not as a race or a task, but as a kind of gentle massage, something meant to keep your tissue healthy, your blood flowing, and your mind connected with your body. The more you approach this time with patience and kindness, the more rewarding it becomes. You don't have to force pleasure. You just have to allow it in the right conditions. The second major mistake is one I see again and again: rushing. And while it might seem like a small thing, I want you to really pause and consider it, because the impact of rushing through self pleasure at this age is bigger than most men realize. A lot of older men treat masturbation as something they need to get over with. It becomes a habit of speed, done quickly with tension, often in silence and secrecy. But the truth is, this kind of rushed touch can quietly begin working against you, especially after 60. Here's what happens when you rush: your nervous system stays in a state of alertness. Your blood vessels squeeze tight instead of opening up. Your heart rate may rise, but not in a healthy, relaxed way, more in a stressed, shallow breathing kind of way. Your brain is still looking for danger or interruption. And instead of receiving deep, nourishing blood flow to your penis, your body stays on edge. This prevents you from truly relaxing into sensation. And the result? You might end up feeling unsatisfied. You might feel a little sore, or worse, you may find it harder and harder to even feel aroused at all. When this becomes a repeated pattern, your body gets trained to connect touch with tension, not with safety, not with calm. And that means your arousal process, which should be smooth and enjoyable, becomes more mechanical, more rigid, and less responsive. The good news is that this can absolutely be changed, and it starts with a simple shift. Give yourself more time. Even just a few extra minutes to slow down, take a few deep breaths, and actually arrive in the moment can change everything. You don't need to turn it into a spa ritual unless you want to. But creating a small window where you're not being pulled in five directions, not checking your phone, not waiting to be interrupted, that tells your body it's safe to let go. And when your body feels safe, the blood vessels soften, the nerves wake up, the tissues become responsive again. And that, my friend, is when true satisfaction happens. Not through pressure, not through speed, but through presence. Through giving your body the gentle attention it's been quietly asking for all along. Now, the third mistake might catch you off guard because it has nothing to do with how you touch your body. It has everything to do with how you feel about it. And ignoring the emotional side of self pleasure is something many older men have done for years without realizing the impact. Because let's face it, most of us were never taught that our emotions and our body are connected, that our thoughts, our memories, our stress levels, they all shape how we experience touch and arousal. For some men, this shows up as shame. Maybe you were raised to believe that masturbation was wrong, dirty, or something you should hide. For others, it's about the changes that come with age, like the way your body looks, the way it responds, how long it takes. And slowly, these thoughts can become quiet sources of stress. You start wondering, am I normal? Is this okay? And instead of finding comfort in the experience, you feel tension, guilt, or even avoidance. But here's what's important to remember: emotions that are pushed down don't just go away. They get stored in your body, in your muscles, in your breath, even in the way your blood flows. Over time, this emotional weight can lead to performance anxiety, disconnection from your body, even depression. And for many men, that loss of connection turns into a loss of desire. Not because their body can't respond, but because their heart no longer feels safe in the experience. So, what can you do? First, start with compassion. Remind yourself that this isn't about performance or proving anything. This is about connection, healing, taking care of yourself in a deeply personal way. And if you find that difficult, that's okay too. Talk to someone. It could be a doctor, a therapist, even a friend who understands what you're going through. There's nothing weak about needing support. In fact, it takes strength to open up about something this personal. You deserve to feel safe in your own skin. You deserve to enjoy your body, no matter your age. And being honest about your emotions can be one of the most powerful steps toward that. It's not just about physical release, it's about self respect. And it starts with letting go of shame and replacing it with understanding. Now, let me share something incredibly important that most doctors don't talk about openly. But They should, the connection between regular ejaculation and prostate health. Here's what research has shown. Men who ejaculate regularly, whether through intercourse or masturbation, have a lower risk of developing prostate cancer. Multiple large studies, including research from Harvard Medical School, found that men who ejaculated 21 or more times per month had about a 20% lower risk of prostate cancer compared to those who ejaculated less frequently. Now, I'm not saying you need to hit a specific number. What matters is consistency and what feels right for your body. For most men, over 62 to 3 times per week is a healthy, sustainable rhythm that supports prostate health without causing strain. But here's what you need to pay attention to. There are warning signs that should never be ignored. Blood in your semen, even a small amount. Pain during or after ejaculation. Difficulty urinating or a weak stream. Pain in your lower back, hips, or pelvic area. Any unusual discharge or persistent discomfort. If you experience any of these, don't wait. See your doctor within the week. These could be signs of prostate inflammation, infection, or in rare cases, something more serious. Early detection saves lives. The beautiful thing is that by taking care of yourself through gentle, mindful self-pleasure, you're not just experiencing pleasure, you're actively supporting your prostate health. You're keeping blood flowing, reducing inflammation, and helping your body stay resilient. This isn't indulgence, it's preventive medicine. And your body will thank you for it. Now that we've walked through the 3 biggest mistakes and talked about prostate health, let's focus on something hopeful. How to create a healthy, safe, and satisfying self-care routine. One that supports your health, honors your experience, and feels good in every sense of the word. Start with cleanliness. Make sure your hands are clean. If you use any tools, cloths, or towels, keep them clean too. Try to create a space that feels quiet and calm, somewhere you can be alone, undistracted, and relaxed. Use a natural, fragrance-free lubricant to protect your skin and make things smoother. And always, always pay attention to what your body is telling you. If you feel pain, discomfort, tightness, or notice any changes like swelling, sores, or irritation, don't ignore it. These could be signs of something deeper like inflammation, circulation issues, or even a condition related to your prostate. And a doctor can help. But when done gently and mindfully, this practice can become a source of health. And if you're feeling unsure or like you're just beginning again after years of disconnect, that's perfectly okay. Many men rediscover their connection to their bodies in their 60s or 70s. It's not going backward, it's evolution. It's learning what your body needs now, not what it used to need. And that's a beautiful thing. You're not broken, you're not past your prime. You're simply in a new phase of life, one that asks for more care, more intention, and more kindness. And when you respond to your body with that kind of care, it will respond back, often in powerful and beautiful ways. So tonight, or whenever you feel ready, give yourself the gift of attention. Not performance, not pressure, just presence. You deserve that. Your body has been with you through everything. It's carried you, worked for you, and loved for you. And now, it's asking for something simple. To be treated with gentleness, to be honored, to be cared for. This isn't about chasing what you used to be. It's about celebrating what you are now. A man who's lived, who's learned, who's still here, still curious, still deserving of pleasure and connection. And if you found this helpful, please consider subscribing because your body still matters, your pleasure still matters, and your confidence is worth protecting. I'm Dr. Elizabeth Rains, and I believe in your ability to age with strength, dignity, and joy. Until next time, stay strong, stay curious, and take good care of yourself. You're worth it.